Can you introduce yourself and tell us about the Learning Disability Wales?
Yeah, my name's Simon. I'm a dad and I work at Learning Disability Wales in the training and events team. Learning Disability Wales is a fairly small organisation. There's only about a dozen of us work here and we do quite a lot of work. I'm involved in running training courses and conferences and different events for people with a learning disability and people that work with and for people with a learning disability. And we also run an information service which gives information which is useful for people in Wales. And we run different projects as well, helping maybe develop person-centred planning or looking at different things like that. Anything to do with a learning disability in Wales.
What are you doing, Simon, to help parents out there with learning difficulties?
We're doing a few things at Learning Disability Wales, hopefully to help parents with a learning disability. One of them is running the networks and bringing people together. But we always need money to be able to do that. And sometimes we've got the funding to run those networks and sometimes we don't. We also try to make sure that the Welsh Government are aware of what the needs of parents with a learning disability are, and we're always trying to make sure that they consider parents with a learning disability in any policies or laws that they're bringing in as well. We provide an information service, so people contacting us, hopefully we can signpost them to organisations that support as well. And through our website and our magazine as well, we can run articles about issues or tell people stories as well. And sometimes parents telling their stories can be very powerful, and I hope that we can help in doing that as well. And then there's all sorts of other organisations doing good work with parents out there. And so any sort of support that we can lend them, we're always willing to be able to offer that. People can ask.
Can you tell us about the Parents Network and what they do?
Learning Disability Wales have run a parents network for a few years now, and it's really working with other people who work with parents and with parents themselves. So meetings maybe 4 or 5 times a year in North Wales and South Wales, and it's a chance for parents to get together and people that work with and support parents with a learning disability to get together and talk about things that are important to them, so the parents can maybe share worries or concerns or successes, good things that are happening in their lives, and maybe decide a piece of work that they want to do together. And the parents can, and the professionals can talk about maybe a difficult case they're having and how best to support a parent, or a problem they might have been having in getting the right information, and so the workers can support each other as well. And one of the things that the Parents Network is trying to be doing for a number of years now is to get the Welsh Government to give some guidance to local authorities and health organisations on how best to support parents.
Can you tell us a bit how the parents are assessed?
Parents with a learning disability, if social services are involved, they'll often carry out an assessment of the parents to see how well they're doing, how well they're coping, and the care that they're giving to their children. And I'm not an expert in that process, but I've talked to some parents who've been assessed, and I've talked to some workers who have worked with parents who've been assessed, and it seems it's quite a complicated and drawn out process, and involves people coming into people's homes or parents having to go to an assessment centre. And it's quite right that that assessment process should be detailed and have a good look. But I think one of the things I hear a lot is that it tends to be more about finding out what parents can't do rather than what they can, and can sometimes place parents in a situation where they're not able to show what they're good at because they're taken out of their own home and not in their own environment. So straight away they might be feeling uncomfortable. One parent I spoke to recently went to an assessment centre, and she said it was like the Big Brother house because there were cameras everywhere, in the bathroom, in the toilet, and she could never relax. and she never felt she was able to be the mother she wanted to be because the environment was so unnormal. It wasn't what she was used to. So it needs to be detailed and it needs to be careful because we're talking about children and children's happiness and their care and their safety. But I think the assessment process can be quite intrusive and professionals need to be aware of that. And there are different ways of assessing parents, and some of them are a bit more person-centred, that take into consideration, you know, the whole family and the support that the whole family gets, and the strengths that can be brought out of doing a person-centred assessment, I think should be looked at carefully.
What support is available for parents with learning difficulties?
Overall, there's not enough support, I don't think, for parents with a learning disability. And the support that each parent needs will be different. Some won't need any support at all. They might just have a bit of help from family or friends or none at all. And some might need a lot of support. They should be able to get some support from social services. But sometimes parents are scared to ask for that support because they're worried about what social services might do. And so it's a shame that they don't often go and ask for the support that they might be able to get. There's lots of voluntary organisations that would like to give support, like People First groups and advocacy groups, but sometimes they don't have the money or the time to be able to provide the support that they would like to be able to offer. But there are some groups in Wales that do offer that support. Some children's organisations and some learning disability organisations.
Can you tell us what the advocacy organisation do?
There's a few advocacy organisations out there that can support parents with a learning disability, and what they do is they work alongside the parent and help make sure that the parent gets to say what they want to say when they need to say it. Because often when a parent is involved with social services or the courts, because there's problems around the child being taken into care or placed for adoption, there's lots of scary meetings, there's lots of confusing information, and it's very difficult for people to understand what's going on, be involved and have their voice heard. So advocacy organisations are there to help parents make sure that they understand what's going on and that they're able to have their voice heard and say what they want to say in the process with social services or the courts.
Are midwives, doctors and health visitors aware of the need that the parents need with learning disability?
It's important to remember as well that sometimes a midwife or a doctor, they won't have it written on a piece of paper that this person's got a learning disability and they need extra support. So they need to be mindful of thinking about their patient, the person they're working with, and trying to work out, might this person need some support? Might this person have a learning disability? And there are some tools out there to help them recognise if somebody doesn't have a diagnosis of a learning disability, who might have one, and therefore be able to make sure that they get the support that they need. Okay. I think people that work in health services are just like the people who work in social services. Some of them know about what parents need and are brilliant, and some of them don't know about what support parents with a learning disability might need, and they need to be better at it. So it's mixed, really. It's really important that any sort of professional working with a parent with learning disabilities should know some of the basics, or where to go to get more information, or their colleagues who know how to do a really good job in working with parents with learning disabilities. Because it can be a specialist job, knowing what the particular needs are, and not everyone can be a specialist. So if they don't know, they should at least know where to find someone out who does know a lot more. So I think everyone should know a little bit, and be aware of parents with a learning disability might have some additional needs, and be able to contact colleagues who really know how to work well with them.
Where parents or future parents would know where to go for the help?
I think some of them would, particularly those parents that are involved with the People First group, because those groups are really good at connecting people with organisations that can help them. And some will find out if they've got a good midwife or a good health visitor who's got their brain switched on to parents with learning disabilities and what they need. But I think a lot of people out there will struggle to be put in contact with the organisations that could help there. So I think there's a role that health visitors and GPs can play in making sure that they recognise that some parents might have a learning disability and find out what services are available in their area to support them.
Is there enough support out there?
That's a big question, isn't it, actually? I don't think there's enough support out there, and I don't think you would find anyone that disagrees with me. Support can be given from a number of organisations. There's advocacy organisations and People First groups and children's organisations and family organisations that work in the voluntary sector. And they can give really good support, but they always need funding, and they're not getting enough money to provide that support. So some of it's there, and that's really good, but there needs to be more funding available for them to be able to give that support. And it's important to remember how much support social services can give to parents as well. Some social workers know a lot and can really give that support, and some social workers don't know as much as maybe they should do, and so they can't support as well as they should be able to. So I think social workers generally need more training to make sure they can support parents, and I think the best people to give that training is parents with a learning disability themselves. And social workers always, actually, they're under a lot of strain. They've got loads of people on their case books, so they're hugely overworked, and I think if they had more time to spend with parents, they would be able to do a better job. And most social workers want to do a good job, actually, so I think they need training and more time.
A lot of parents we know have been told it was too expensive to support them long term, even for a few hours a day. Do you agree?
No, I don't. I struggle to think why it would be too expensive to support a family. And I think maybe there's some other situations where people might be willing to spend more money on supporting a family, and when they're not spending that amount of money because it's a learning disability, that disturbs me a lot. There's been some research done as well to show that some support and some advocacy can actually be cheaper in the long run than not providing that support. So, I mean, the bottom line should be about happy, healthy children in families, whatever that makeup of that family should be. So I think money is important, but we should be, as a society, investing money and supporting people who need that support. And so a bit of help in the early days might mean that people become more independent and they don't need that help long term. But if they do need that help long term, I think we should, as a society, be supporting those people.
Thank you.
I think any parent whose child has been placed for adoption and adopted, they're going to be really traumatised because it's a horrible experience. And I've met a number of parents who've gone through that, and you can see how it affects them for the rest of their lives. So they need to be given support. That might be counselling, it might be different types of support. Now, local authorities should be providing post-adoption counselling to any parent who they take their child off and place them for adoption. And talking to a number of parents, that isn't really been done very well in Wales, and it needs to be done better. I know of one parent who's really suffering because of what she's been through as a mother, and now got mental health problems on top of grieving for the child that she's lost. And that could have been helped if she had got the support or the counselling which she deserved as a mother who's lost her child.
What can we do to get more support?
I think one of the best ways to get more support is to make your voices heard. Particularly, I think, to the Welsh Government and to local authorities. and they do want to do a good job. They might not always know the best way to do good job, and so it's down to parents and people that support in parents to make sure that they speak to the ministers and the civil servants at the Welsh Government and tell them about the experiences of parents with a learning disability, tell them what parents with a learning disability need and how services and support can be done better. You can fight lots of individual cases for a parent to make sure that that one parent gets the support that they want. But if you don't have a look at the policies and what by law local authorities and health services should be doing, you're going to be fighting individual cases again and again and again. So we need to make sure that, you know, policies are changed and laws are changed so that all parents, even the parents that we don't know about, can get the support, not just the ones that we do know about and the ones that we can stand beside and support directly.
How can they go and ask for the help without being scared?
I think sometimes it takes being a little bit brave, because sometimes parents are scared of social services. So I think they should get in contact with some advocacy organisations, whether self-advocacy or independent advocacy, and seek the support that they need, because asking for help is actually a sign of strength. It's not a sign that someone's weak. Asking for help is recognising, I need help now. And I think any professional worth their salt will recognise that that is a good thing in a parent, that they've asked for help, because we all need help sometimes. So yeah, maybe swallow your pride, be brave and ask for some help and get some advocacy and some support along the way as well.
Thank you for giving us your time and talking to us, Simon.
It's been a pleasure anytime.
Thank you.